Hey guys, good morning. Welcome to episode 20 of Coffee with Christine. All right, so yesterday, just a quick recap. We made some um we made some statements and we talk about just the healthcare and providing healthcare for undocumented people. So that's a big topic currently. I do want to recap really quick. So one of the things is that there's this there's this thought that's floating from the Democratic side that I think is not accurate. So I want to clarify, and I clarified it last time, which is um, the kids will be always covered. So we have a lot of laws, both federally and statewide, that says anyone who's 19 years old, they will always have insurance. They will always get care. That's one. And then on the second one, like another thing that they don't, like they always tell us this story that, hey, if someone gets hurt, they're gonna perish and no one's gonna take care of them because they don't have insurance. And they imagine someone with no legal status just not being accepted in the ER, for example. So that's also not true. So both federally and statewide, there's strong laws that makes it so that you cannot deny care. So whenever someone is in need, there's no such thing. Unfortunately, in a lot of other countries, this is the case, but not in America. So whenever there's an emergency situation, those are always covered as well. I think the conversation here is that should they receive the same amount of resources when it comes to Medicare or just like healthcare in general as the normal population. And so I made this it's funny how I made the statement yesterday that my answer is no. I don't think so. And let me explain. And I explained it yesterday, but I want to finish the conversation today. Although we're gonna need to go fast on this one. I'm sorry. Um, it's a no, but I have a plan. I have a plan on how to make this better because I think it's great. I think it's great that people are thinking about this from a perspective of caring, and I think it shows the heart of California. It shows how wonderful California is, and it's always been one of the most giving state, and the people have always been this wonderful, innovative people. I believe this to my core. I think the idea, though, is that especially when regular people or the working class, let's just say the working class, because what is the regular people anyway? I think working class is a little bit more easier to imagine from the objective standpoint. But when you're talking about the working class is pretty squeezed. So for them, they're already doing two jobs. They're already doing part time. They're already sacrificing so much for themselves and for their families. So to ask of them to give more, for the sake of others, that gets a little bit challenging. And in psychology, in nursing, I encountered this term. It's called the Erickson's hierarchy of needs. So it's a pyramid. So in the very base is basic needs, right? Like food, water, and then you go up and then you go to security, which is housing, and then you go to relationship. So it's saying is that as human, you need to be able to satisfy the bottom levels first before you can go to, for example, the very top is self-actualization. And so before you can go really high, most of the time it's hard to do that if you didn't, like, let's say, without your consent, you don't have the basic, you don't have the food, you don't have the shelter. So I think this is why I love nursing, as I always say, is that there's a lot of not just theoretical but practical application, and also reality that I think nurses sees that most people kind of missed. Yeah. So I think from the Democratic side, one of the things they don't understand is it's not really that the working class are mean and they don't want to provide help for these people, but it's really they're barely getting by. And I think that's a logical statement. It's a logical data to consider, like from both, not just a humanitarian perspective, but from a financial perspective as well. It's like, it's like asking like someone who's unhoused to give more of their stuff, so it's hard to say. It's hard to tell someone, you should give more. Um, and that's why I think it's important for us to not inject our own opinion, either side, right? But again, the premise that if we remove medical, which is again, we weren't supposed to do that anyways, and we've been doing it for so many years, and it caused so many issues. And we spend so much. So a lot of people don't know that when the federal government gets mad, it's because they didn't sign up for this. So I think it's logical, right? It's logical that if California wants to pay health insurance for the undocumented community members, then they should pay for it. But currently, that's not the case. It's a big chunk. I think 60% is coming from the federal aid. So it's kind of not fair. And my focus is that outside of all of this, I was talking yesterday about the two-class system. I don't know when that happened, but from our just trying to be quiet and not rock the boat, we have created a two-tier system when it comes to our society, which is one tier is people that have to abide by the law and follow the law and contribute, and then another system that is like it's just hush, people that we don't talk about. And no, I mean we talk about them, but people that we don't enforce the law on them, because one of the reasons is because it's hard. Another thing that I want to point out before I say my proposal. Sorry, excuse me. Another thing that I want to say before my proposal is that the second tier system, it doesn't only compose, it's always hard to talk in the morning. Apologies. So the second tier, I don't want to say it, a different tier system, that group of people, it's not only undocumented people. There's a lot, sadly, there's a lot of shady people that jumps in that, and they can. So what I'm trying to say is that they pretend, for example, because they used to be in the working class and they realize how much resources that is given and how much we look away in terms of this other group. So they pretend to be part of that group. Or I shouldn't say that. They just join that group, I guess I should say. And those are people that commits fraud. They lie about things. And I think, as I said in my other video before, when I was trying to understand medical, right? Because before 2026, there was no income limit. There's no income. There's no balance limit for like savings. They don't count your primary house. They don't count your car, at least your primary car. But you can have whatever, millions of dollars. And I think most of us know this. We know people that's like, how do you get free of this stuff? Like that's crazy that they get this free stuff when that it's supposed to be for people that have no money. But they lie, and that's not cool, because they're even taking more in the chunk of the people that the people that supposed to take it from. So supposedly the social system is created, like the social support systems are created for the people that are having a hard time. So having a hard time, and people that can't take care of themselves, right? So they don't have social support, so government has to come in. But now you have people, it's supposed to be a small group of people that I think legally and financially and ethically, the bunch of us that are working agreed. It's like, okay, that makes sense. Let's take care of these people. But now it seems like this group is starting to get a lot bigger than this group. And so a lot of people, they're like, oh, I don't want to, it's not good to be part of this group. Let me join that. I remember one time there's this doctor, so we have this doctor that works, and so we're supposed to ask for insurance when they get their vaccines, for example. And this doctor, she just like straight out say, oh, I have no insurance. And she has insurance, but she would rather take the medical insurance and say that she doesn't have it, instead of like her insurance coming through. It's the same thing when you unfortunately got into a car accident, and then you just kind of circumvent the insurance, and you just try to like hand them $200 or whatever the case may be, so they don't report. But there's a lot of those that's going on. Oh, I forgot to tell you guys. So that's what I was trying to say, is that when I was researching, because I was like mind blown when I realized that that now that they added the amount, it's 130,000 in cash that you can have. I don't have 130,000 cash. That you can have that type of money. When I was researching it, right away it says about estate planning. So lawyers that's telling you, hey, come talk to me. I'll tell you where to hide your money so you'll qualify for medical. It's there. You should search it. It's in YouTube everywhere. But the point being is that it's just kind of sad that there's a lot of this group, and they're taking advantage. Dude, the sad part, even insurance are doing it because they know how bad government has been managing this money, that they actually refuse to pay. They're like, no, you guys pay for it. We'll see if we'll discuss that someday. But the information I have is like from the inside, so I kind of don't wanna. I keep thinking, did I sign a disclosure like non-disclosure clause? But anyways, so it's pretty bad. It's like a lot of people realizing that the government just pays, and then so they just wanna, they just wanna let it go because they pocket more money themselves. So I guess let's talk about my plan, since I don't think we should live in this two-tier system much longer. And I do want to say, when you listen to the politicians, they don't really have an actual plan because it's not easy. You guys, it's not easy to find a plan that is both ethical and could please everyone. It's not an easy concept. I mean, you guys can try it. I think everyone should try it actually, because maybe we can come up with a solution as a community that would be beneficial, or like would do the maximum good. But anyways, the plan is this. I don't know if I can do it if I'm governor, but I'm thinking first we have to we have to be homies with the federal government because we need their support. So we need to talk to the federal government, and we need to see if this could be done. What I propose is that for anyone, this part I'm not 100% sure yet, but for anyone that's been in the States, or not States, been in California for maybe 7 years or more, you guys tell me, but 7 years or more, and they don't have a crime, we should have a state-sponsored, it's like B1, a state-sponsored work visa. I know that staying in the U.S. is a federal thing. That's why we have to be homies with them. But there's no easy way to fix an issue that it's again estimated to be over 2.5 million people. There's no easy way to fix that in terms of documentation, and just Republicans like, oh, just deport them all. It's not that simple. It's not that simple. Even from like a logistic perspective, the amount of work that's gonna require that is not gonna be that easy, and it's gonna cost us a lot of money also. But again, I think what we can do is to have a state-sponsored B1. So I know we already have DACA, which again, as I made a statement, I think that's a good program. But what do we do for people that's already been here? I was debating with someone yesterday because they're like, like just give them money, which is what we're doing that right now. I think we're doing like 2 grand for them to self deport. But this is coming from someone who's an immigrant. I don't think that's enough, to be honest. Not to say that I'm like asking the state more, but it's not an enough money because the quality of life in these places is really really bad. And so especially when you have kids, the America's pretty great and California is even better. So I don't think $2,000 is a good enough incentive. That only works if you actually have a lot of close family in that country you're going to, and you still have roots there. But imagine someone who's been here for 10 years, they're not gonna have, this is their life. Because I don't even think, yeah, they can't go back and forth. So they've been here, like most of the time they've already been just kind of hanging out here. But to wrap it up, the emergency services, pregnant people, all the kids, public health concerns, those are always covered. You don't need to fear because sometimes Democrats use that narrative. That's never going to change. They're always going to have, every single person will always have that coverage. But we have created, even outside of healthcare, we have created a community that is above the law, unfortunately. Above the law and receiving all the social services and all these exceptions, and everyone is jumping into the pot. And those are your employers. Those are those side gigs. Those are your people that are committing fraud and don't want to pay their fair share. And in their defense, because it stops over here having to pay much, but we have to fix this system. So my proposal is that anyone who's been here for over 7 years without any crime, like big crime, right? Not like speeding tickets or anything like that, but anyone who didn't commit crime and been here for over 7 years, I think that we should give them like almost like a state sponsored B1 with state sponsored um like employer card, so they can work and they can participate and they can be provided healthcare by employers, and they can pay, they just be really a part of the community that they're already serving, but they don't need to do it. They don't need it to do it in a way that they're afraid. So remove this category and move them to the contributing people. And I think that's gonna be helpful in so many ways, because a lot of these people have so much potential. So it's kind of silly to not tap on that. I do want to say, unfortunately, I don't. I say 7 and up because, dude, I don't even understand why they open the border like that. Like everything has to have like some type of rule. But anywho, so that is only applicable to people that have been here 7 years. Maybe I'm not so sure about the years, but like significant time. So they cannot just jump in the border right now and then claim this state sponsored visa for working visa. And then in return, I think we should have a relationship with the federal system. And when we have people that are not documented that committed crime, we should, like any professional relationship, we should be able to kind of approve their request for wait for release, or just give them a heads up right off the bat, for those people that have committed some crime. But again, I think ultimately, there's a lot of abuse, and I want people to be able to dream big for their children, and it's kind of not cool to always live in fear. So I think majority of those people, we have to move them in this spot, and then see, and then from then it's not going to be such a heavy load to provide healthcare, because now we're trying to figure out where to get this money because federal government said no more. Excuse me. So anywho, that's the plan. Let me know if you guys have any thoughts. But I think it's gonna work. I think if we can do a state sponsored work visa, and we can make it easy for these community members to take advantage of that. So none of this super complicated. Not that it was complicated, but none of this super compli. Okay, sorry. I was thinking of different things, but none of this pretty expensive and complicated lawyer fees and whatnot, and just make the process easier for them, and they don't have to live in fear, and they don't shady people don't need to hide behind them. I think that would be cool. So yeah, let me know if you guys like that plan. Um, we'll see how it goes. Maybe some people, maybe the next governor, can hear me and then would would make that work. But anywho, you guys, thank you for listening. I have to go to work. Coffee with Christine. I'm so happy. Happy weekend. I'll see you guys Monday. Bye.